I'm Rachel Huot. I've been a volunteer in the EMS community here in St. Mary's for 8 years. A few of you requested some information about what to expect during a medical emergency, both when EMS arrive at your doorstep and what to expect at the ER should you go to the ER. And we're just going to go over a few of those scenarios. Some things that we're going to talk about today are signs and symptoms of stroke, sepsis, heart attack, atrial fibrillation. We're going to go over MULS DNR, when to go to an urgent care versus when to go to the ER versus when to just call your doctor. Some things to think about regarding your prescriptions and going over health literacy. So we're going to start with stroke signs, symptoms, and what to expect during this emergency. There are 4 types of strokes. The first type of stroke is an ischemic stroke. This is when you have a blood clot that stops the flow of blood to a part of your brain, so similar to a blood clot. The second type of stroke is hemorrhagic. This is a blood vessel that has ruptured and causes bleeding in your brain. The third type of stroke is a TIA, or a mini stroke, and during this you have similar signs and symptoms to a normal stroke, but the symptoms quickly resolve. The fourth type of stroke is posterior or brainstem stroke. The blood supply to the back of your brain might have a blockage or a rupture in that artery. Here are some risk factors for developing a brain stroke: smoking, some type of medications, consumption of alcohol, having diabetes or high blood pressure, and obesity. Here are some symptoms that someone might be having a stroke. They might have one or more of these symptoms. One sign is facial drooping to one side of the face, slurred speech, sudden weakness or numbness of one part of the body, loss of vision or balance, or having the worst headache that you've ever had. We're now going to show you what we do for a stroke test. There are 2 different types of stroke tests. The first one is the Cincinnati scale. The second one is the LA scale. The only difference is the Cincinnati scale tests arm drift and the LA scale tests grip strength. And typically we do all of it at the same time. So the first thing we're going to ask is, have you had a loss of vision or any sense of unbalance?
No.
Okay. Next, we're going to test facial droop. Go ahead and smile for me real big and show me your teeth. Awesome. Next, we're going to do arm drift. Go ahead and hold your arms out in front of you, close your eyes, and keep your arms there. Awesome. If there is a drift in one arm or the other arm, this is a positive indicator. You can put your arms down. Next, we're going to test grip strength. Go ahead and squeeze my hands as hard as you can. This is similar to the arm drift. We're looking for a sense of unbalance. Finally, we're going to test speech. Repeat after me. You can't teach an old dog new tricks.
You can't teach an old dog new tricks.
We're looking for any slurring of speech or being able to understand them in general. If you or a loved one thinks that you're experiencing a stroke and you call 911, EMS is going to come in and perform the stroke test that you just saw. We're going to gather information about what's happening, a list of medications, your medical history, and other important health information. If you or a loved one is having a stroke, it is really important to know the last known well time. What this means is the time that the symptoms started happening. So if your loved one started having slurred speech an hour ago, we need to know it was an hour ago. If you visited your loved one today and you haven't seen them for 3 days and they're having these stroke symptoms, we need to know that it's been at least 3 days that they could have been having these symptoms. We might also check your blood glucose and give you glucose if appropriate. The reason we need to know the last known well time is because if it's within 22 to 24 hours, we can get you the appropriate care. If it's within 22 hours, EMS will go priority 1, meaning lights and sirens, to the emergency room and call the emergency room to say there's a positive stroke. During the ambulance ride, you might get an IV. Once you're in the ER, the nursing staff will also perform their own stroke test, and it might be a little bit different than what EMS has done. They have vision, reading, and comprehension, and they also have speech test. They might have a little picture about like a little boy grabbing a cookie jar, and based on that test, they can tell which part of your brain is being affected. If EMS didn't give you an IV during the ambulance ride, the nursing staff will definitely get an IV. You might be rushed straight to CT, and if you're having an ischemic stroke, meaning you have that blood clot, and it's within the 22-hour window, then you might receive thrombolytic therapy. This is the use of drugs to break up or dissolve the blood clot. Now we'll move on to sepsis, signs, symptoms, and what to expect. Sepsis is when the body has an overwhelming response to an infection. So normally your body can fight off infections, but if it has been there for a while and it's not getting better, your body might be overwhelmed and it will trigger an inflammatory response. There are two types of sepsis. There's warm sepsis, where you have a fever, and there's cold sepsis, where your body temperature is lower than the normal. Septic shock happens when the sepsis has been persistent and it goes untreated. Septic shock can result in organ failure, respiratory failure, meaning you're not able to breathe, heart failure, or even death. Here are some of the ways that you can develop sepsis. You might have meningitis. There might be a skin or soft tissue infection, especially if your loved one is bedbound and doesn't get turned in the bed regularly. You might have a UTI, which is common in the elderly population, especially if, again, they're bedbound or they're using adult diapers. Pneumonia, or any kind of stomach infection. This is what EMS looks for if we suspect sepsis. We're going to look for that source of infection, or any factors that might lead us to believe you have an infection. Again, the most common might be UTI, and UTI does have a certain smell, or if someone is bedbound, then we might suspect that. Plus, we're going to look for the warm or cold sepsis symptoms, meaning you have a fever, which is over 100 degrees, or the cold sepsis, which is under 59.5 degrees Fahrenheit. You might have a high heart rate, meaning your heart is beating really fast, over 100 beats per minute. You might be breathing really fast. You might have really low blood pressure, under 90. Or you might have altered mental status, or just not acting right. So if EMS thinks that sepsis is going on, you're definitely going to get an IV. If you are unconscious or altered, or for some reason we can't get the IV started, then you might get an IO. That means intraosseous, which means they're going to drill either into your shoulder bone or your shin bone so that we can give you fluids. You're definitely going to get fluids. However, if you have a history of congestive heart failure or any kidney issues, then we might not give you as much fluid as everybody else. We're going to do a 12-lead EKG, which is taking a picture of your heart. Again, we're going to check your glucose. And if you have low blood pressure, your sugar is low, or you have any abnormal heart rhythms, we'll give you medications as appropriate. If you are having sepsis, we're going to go priority 1, which means lights and sirens to the ER, and we're going to call the ER for code sepsis. You need antibiotics right away if you're not allergic, and they need to be on the alert that we're coming in. Once you're in the ER, if for some reason EMS was unable to give you IV and fluids, then the nursing staff will definitely get you an IV and fluids. They're going to draw your blood. They're going to do blood cultures. Again, if you're not allergic to antibiotics, you need antibiotics. If you're experiencing any low blood pressure, hypotension, any low blood sugar, or you have developed any abnormal heart rhythms, they're also going to give you medications as appropriate. If you're in septic shock, then be prepared to be admitted to the hospital. So another term for heart attack is myocardial infarction. Some signs and symptoms that you're having a heart attack are pain in your left arm, jaw, neck, or chest. You might be very nauseous, sweating profusely. You might be short of breath when you're doing simple tasks, such as pushing your trash can down the driveway, and you're out of breath just from doing that, and that's not normal. Your chest pain might be described as squeezing, tightness, crushing, or feels like there's an elephant or somebody sitting on your chest. You might have dizziness. You might pass out. or just have really unusual body fatigue. The symptoms in men are slightly different than the symptoms in women. So how do you know if you're having a heart attack, or if it's just heartburn, or maybe just a panic attack? Because these can all look very similar. The heart attack, again, has that chest pressure or squeezing. It's mostly in the center of your chest or radiating out to your arms, and it doesn't get better with anything that you do. You might be profusely sweating, the shortness of breath, or have that fainting episode. With heartburn, however, there might be a burning or chest pain that's under your left rib or in the center of your sternum. You might have a sour taste in your mouth or have that indigestion feeling where like fluids are coming up your digestive tract and you just feel kind of gross. A panic attack, you might have sharp stabbing pain in the center of your chest, and that doesn't spread throughout the rest of your chest. While you might be short of breath and breathing really fast, it could be from hyperventilating. Panic attacks are usually from stress, or if you have an anxiety or panic disorder. You might have racing heart, where it just feels like your heart is beating out of your chest. Again, that doesn't coincide with your chest pain. And then if you are having a panic attack and you're hyperventilating, you might experience tingling and numbness in your hands and your feet, or they might cramp up on you. And this just shows you that you're hyperventilating and you're not getting enough oxygen. So if you think you're having a heart attack, EMS is going to come in and we're going to ask you about the pain. We're going to ask where your pain is, what your level of pain is, and where in the body you're experiencing that. We're going to get your medical history, your list of medications, and ask you if you've ever had this kind of pain before. If we think that you are having a heart attack or some kind of cardiac event that again isn't heartburn or a panic attack, and you're not allergic to it and you don't have stomach ulcers, we're going to ask you to take aspirin if you haven't already. Unfortunately, we do ask you to chew the aspirin. We're going to check your blood pressure, your heart rate, your oxygen levels, and we're going to do a 12-lead EKG, which is taking a picture of your heart to get a better understanding of what's going on. Based on that assessment, if you are having a heart attack or some other cardiac event, we're going to give you medications, oxygen, and an IV as appropriate. If you're having an actual heart attack and not another cardiac event, we call this a STEMI. You might get flown to a specialty center if the weather is clear. If the weather's not clear, then we'll drive you to a specialty center. Some of the specialty centers are Southern Maryland Hospital and MedStar Washington Hospital Center. If you're just having another cardiac event that is not a heart attack or STEMI, then we will drive you to the ER. If for some reason EMS wasn't able to or didn't have time to get the IV, the nursing staff is going to get you the IV and draw blood. They're going to draw for troponin levels. Troponin levels are inside the muscles of your heart. And this is to see if you're having a heart attack that's not detected on the 12-lead, or if you're having other heart conditions. They're going to run their own 12-lead, even though EMS did their own. You might get a chest x-ray, and then if you need any medications, they're going to give you medications as appropriate. If we didn't catch you having a heart attack on the 12-lead, but the troponin levels come back high, indicating you're probably having a heart attack, then you might still get flown or driven to a specialty center. One of the cardiac conditions that could be happening is called atrial fibrillation. Atrial fibrillation, also known as AFib to EMS, and which I will be using for the rest of the slide, is an irregular heartbeat where the upper chambers of your heart are not coordinated with the lower chambers of your heart. So your upper chambers and your lower chambers are in misalignment, and they're firing at different rates, which is not normal. You might feel like your heart is beating out of your chest or it's fluttering. Some people do live with atrial fibrillation and take long-term medications. However, having AFib makes you 5 times more likely to have a stroke. AFib also comes with a risk of heart failure and other health-related complications. If you have a family history of cardiac issues, or if you have AFib, it's important to have regular checkups with your cardiac doctor. Some of the risk factors for developing AFib are high blood pressure, having that family history of heart disease, hyperthyroidism, which means your thyroid glands are producing more of the hormone than they're supposed to, obesity, and sleep apnea. Now we're going to go over what a MOLST/DNR is. The MOLST/DNR form is a document that allows EMS and hospital staff to know the patient's wishes for treatment and intervention during a medical emergency or in the event of your death. There are many options on the form. One of them is CPR in all interventions, which means if you're having a medical emergency, you want all the interventions, or in the event of your death, you want us to perform CPR. Another one is no CPR, but interventions, which means if you're having a medical emergency, you want all interventions necessary to stay alive, but in the event of your death, you don't want to be revived. You don't want CPR. The third most common one is no CPR and no interventions, which means in the event of your death, you do not want CPR and you don't want any other interventions to be revived. The MOLST or DNR does have to be signed by a physician. If you have one of these and you're having a medical emergency or your loved one has passed away and we're coming in to do CPR, EMS needs to see this form. If there is no physical MOLST or DNR form, we cannot comply with the orders. So say your loved one passed away and you know they didn't want CPR, they totally didn't want to be revived, but you don't have that form, legally EMS and hospital staff have to do CPR. So it's important to have that form if you have it. I highly encourage older adults as you retire to get the MOLST/DNR form. However, it's really important to talk to your provider about this, and if you have loved ones or a spouse, it's really important to bring them in that conversation. All right, EMS's favorite topic, when to go to the urgent care versus the emergency room. This is just a fun little improved pain scale that I found, since sometimes it's really hard to figure out what pain level you're at, whether a 1, I don't feel much pain, or a 10, meaning this is the worst pain I've ever been in. I just thought this was a little bit funny. Here's some examples of when to go to urgent care versus the ER. If you have a cut, a cold, if you have the flu or COVID and you're able to breathe on your own, if you're having an allergic reaction and you're able to breathe on your own, any sprains or broken limbs where you're not at risk of losing your limb, any kind of ear infection, go to urgent care. However, if you have an allergic reaction, if you have the flu or COVID and you're not able to breathe on your own, call 911 or go to the ER. If you're bleeding profusely, go to the ER, call 911. Any kind of burns, head trauma, or if there are stroke symptoms, that's a reason to go to the ER. So, emergency rooms are for life-threatening emergencies. You have chest pain, you have difficulty breathing, you're at risk of losing a limb, or you're bleeding out, you're wanting to go to the emergency room. Something to note about urgent care is that if you go to urgent care saying that you have chest pain, no matter what that may mean, whether heart attack, heartburn, you just have chest pain in general, they're going to send you to the ER. If you have the option for, say, a simple cold or an ear infection to call your pediatrician or your doctor, that might save you a little bit more time than sitting at the urgent care. Going to the emergency room when it's not an actual emergency results in you paying more fees out of pocket, higher treatment costs, and you're also reducing the beds and the capability the hospital has to treat actual emergencies. Going to the urgent care is going to cost you less than going to the emergency room when you're not having an emergency. And then if you're able to call your doctor, that might cost a little bit less. Some urgent cares might be able to dispense medications to you right away versus if you call your doctor, they might send your prescription to a pharmacy. However, that choice is up to you. Speaking of prescriptions, many older adults may not know what kind of prescriptions they take or why they take them. They may also not understand their health conditions. I have some patients that say, I don't have high blood pressure, but all the medications indicate that they do. Polypharmacy means having multiple medications. It's a common problem among the elderly community. Having too many medications that might overlap with each other can cause confusion, falls leading to injuries, and even death. Some physicians might not confer with other doctors when they're prescribing you those medications. So there's a risk of you taking multiple medications for the same health condition and may not need it. Having multiple medications can lead to overlapping side effects and other health complications. So it's really important to have a list of your medications and bring it to your providers. It's also important to renew your medications annually with your providers. Again, you don't want to be taking 3 medications for one problem unless you absolutely need to. Health literacy. What is this? This is the ability to understand your health and healthcare, making important decisions about your healthcare, making those decisions with your providers, and just overall having a good idea of what's going on in your health. As we get older, we might experience changes in our cognition, in our vision or hearing that affect the way that we interpret and understand our health information. If our vision is reduced, we might have difficulty reading our discharge instructions or our medication bottles. Patients with low health literacy, meaning you don't fully understand what's going on in your healthcare, can lead to an increase in going to the emergency room, longer hospital stays, being unable to follow treatment plans, which leads to other health complications, and higher mortality rates. So what can you do to be more involved in your healthcare? Advocate for yourself and don't be afraid to ask questions. If you're unable to advocate for yourself or you're scared to ask questions, bring a family member or a caretaker with you to the appointment or when you're being discharged. Legally, they cannot discharge you from the hospital if you still have questions that need answers. They are required to answer any questions that you have, any confusion that you have, and explain exactly what's going on with your health. And again, report all your medications to all of your providers. Also report your over-the-counter medications. So many seniors might take different herbs and supplements that they think is helping their health, and that could have different side effects to your actual prescription medications. Thank you so much for watching. I hope this information was helpful. Should you have any questions, there are contact information here on this slide. Sean Davidson is the County EMS Director, and if you have any questions regarding billing, then you can contact the DES email on the slide. The QR code that you see here will access our Facebook. Thank you.